Hello, everyone, and welcome to the Bear for Health podcast. This is where we talk about health, wellness, and everything in between. I'm your host, Parikshit Chindade, and we are recording this podcast in run up to the World Kidney Day. While kidneys are vital organs, they play a very crucial role in maintaining overall health. However, they don't get as much as attention like the other organs or other diseases get. So today we are going to talk about a very important topic, which is kidney and blood pressure, the silent connection. To help us navigate this topic, we have Dr. Umesh Khanna with us. Dr. Umesh Khanna is consultant nephrologist and founder director of Kidney Associates Mumbai, and he is one of the pioneers in setting up satellite dialysis centers in Mumbai. Welcome to the show, Dr. Umesh Khanna, and it is really a privilege for us to have you at the Bear for Health podcast.
Thank
Sir, let me
you.
start off with our first question. We all understand that the job of kidneys is to do filtration. But what do kidneys have to do with blood pressure?
Thank you, Parikshit, and thanks, Bear, for Health for holding this podcast on such an important topic, and that too in the run-up to the World Kidney Day. And in fact, we are celebrating the World Kidney Month at the Mumbai Kidney Foundation. It's our policy to celebrate the World Kidney Month, and you all are doing a great job in imparting awareness on kidney diseases, which is so vitally important. Let's come back to the topic of high blood pressure and kidneys. The importance of blood pressure in kidney is because majority of the cases of kidney failure or CKD are due to diabetes, and next is high blood pressure and obesity, the non-communicable diseases. All three together would form almost 65 to 70% of cases of CKD. And hence you picked up a topic which is of vital importance. I'm glad that blood pressure and kidneys are being discussed today.
Right. So, sir, my next, question would be that how do kidneys actually affect blood pressure elevation? So, can you explain a bit on that?
Sure. Kidneys are one of the best organs placed by the Almighty in human body. It decides what should be the water level of your body, what should be the sodium level of your body. If you eat excessive salt, it will remove it through the urine. If you drink excessive water, it will again remove it through the kidney. You must ask a kidney failure patient the importance of kidneys. So blood pressure is regulated via sodium management, that is your salt, by the water management, and it produces a hormone called renin. And this hormone plays a vital role in blood pressure management in anybody's whole body's blood pressure management is done by this hormone also. So salt, water, and hormone, three reasons by which the kidneys manages the blood pressure of a person.
So, sir, there's this tricky part because what we've been hearing that high blood pressure as well as kidney diseases, they, usually don't manifest a lot of symptoms and they stay silent, as they call it for many years. So, for a layman who is probably in that age group of developing kidney disease or blood pressure, what are some of those signs that one should really look for while navigating his disease, so to say?
So before we go on to the science, we must also know how blood pressure causes kidney disease. Oh, blood pressure like a hathoda. It keeps on hitting the vessels of the body. It affects many areas. Heart, so that it causes heart enlargement. Eyes, then it can lead to vision problem. But more importantly, kidneys, the blood vessels of the kidneys, they become slowly narrower and narrower, and therefore blood pressure starts coming up. Now, because it's a slow progression, it remains silent for a long time. So people may not understand that they have a kidney disease till a long period of time is over, which is why it's important to do kidney disease detection tests year after year. In fact, it is now said that once you cross 18 years, you must check your blood pressure. So every year or whenever you go to a doctor for any illness, you must get your blood pressure checked. And after 40, 45, or if you are diabetic or you have obesity or you have blood pressure either in you or in the family, kidney disease detection checking is very important. The signs and symptoms come much later. What can kidney disease do? It can lead to anemia. So you get general tiredness, fatigue, that amount of work which you used to do, now you are unable to do. Since the kidneys cannot remove water and salt, you start developing some swelling on the eyes, some edema feet, and if the water retention becomes more, one starts becoming breathless. So this was because of water retention. If your blood pressure goes up, which happens in kidney disease, then you can develop palpitations, you can develop occasionally chest pain, headaches. So these symptoms come up very late. The best way to pick up a kidney disease is by doing kidney disease detection, which is why your buyer for health or our Mumbai Kidney Foundation or other NGOs are trying their best to educate people to get their blood pressure checked, to get their kidney function checked as soon as it is possible.
Amazing. So, sir, I think you have touched upon a very vital aspect here. I mean, we all, as laymen, understand that blood pressure is a very serious condition, and of course, now we also understand that kidney is as vital as an organ. So, in your opinion, sir, what are the best ways to manage blood pressure and essentially protect kidney health?
Yeah. So I also forgot to mention that many people feel that blood pressure will produce chest pain or headaches without realizing that blood pressure can keep on going up till a stage comes when it starts manifesting in the form of symptoms. And that was the reason not only you could have silent kidney disease, you can have silent increase in blood pressure also. Now, your question was on how do you treat blood pressure? So
Yes.
treating blood pressure, it's first best to not have blood pressure. That means prevent blood pressure, for which we will touch upon lifestyle later on as to how to not have high blood pressure by following a good lifestyle. Before that, since you asked me about how do we treat blood pressure, then it starts off with lifestyle changes, followed by, if the blood pressure is moderately severe, then there are medicines which work by reducing blood pressure, either in the form of some drugs called ACE inhibitors or ARBs, which work on the hormone, or diuretics, which work on salt and water and they throw out the extra salt from the body. So you could have blood pressure medicines and you could have lifestyle. So whenever you want, I'll touch upon the lifestyle part also.
Sure, sure. So I think that really brings me to my next question, and which of course is pertaining to lifestyle. So, Dr. Endra, there's a lot of buzz around having a very healthy lifestyle. There's a lot of consensus around diets, a lot of debates about diets. But for our audience, can you just simplify that for managing blood pressure and kidney health, what is the lifestyle intervention that he or she should undertake?
So, first of all, one must understand that lifestyle is the most important way to manage blood pressure. Because with medicines, you will be able to bring down the blood pressure, but it comes at a cost. You will have to spend money. You may have to bear a few side effects in some cases, and you will have to remember to take those medicines regularly. And it works once you already have high blood pressure, once you're already damaging part of your body in the form of eyes, kidney, heart, brain, etc. So it's best that you do take medicines because they are indicated in moderately severe blood pressure. But important is to prevent it by lifestyle changes. Let's touch upon the lifestyle. There are a few areas which are very important in lifestyle changes and blood pressure. Most important is salt. So salt, somehow in India, we consume 2 to 2.5 spoons of salt every day. The WHO recommends 1 spoon of salt. Substitutes in the form of, say, pink salt, Himalayan salt, Sandha namak or Sendha namak as they're called, but they are just 2% less sodium. They are not great in sodium restriction. But you have low salt products which are used by cardiologists more often because in kidney disease you can't use them. Here, out of 100% sodium chloride, 20 to 25% is replaced by potassium salt. So one change is reduce your salt. If you find reduced salt as not very tasty, you can replace part of it with low salt products which contain potassium. So this is first. Salt restriction is mandatory. Remove all the salt shakers on your table. try not to use highly processed food which contains a lot of salt. So one was salt. The second thing is fruits and vegetables. Why is fruits and vegetables good? That means we are still talking on diet because they contain higher potassium. Like sodium is bad, potassium is good. And I'm not talking of kidney patients. I'm talking of normal persons whose blood pressure needs to be kept under control. So low salt, high potassium substances like fruits, vegetables, etc. Third comes walking, exercise, cardio, all that. This means that your blood pressure slowly will come down. It also means yoga can be included in it, meditation, and so on. Weight reduction. Keep your weight under check because obesity will fuel high blood pressure. Avoid smoking or tobacco in all forms. These are 4 or 5 things which you should do to prevent blood pressure development. And we will come later on to other ways in which you can control blood pressure. So lifestyle disease is very important. Ek chammach kam. That means you reduce your salt, oil, and sugar. Oil and sugar to prevent weight gain, salt to prevent blood pressure and heart disease, kidney disease, and stroke. Second, know your health numbers. Everybody should know what is his blood pressure. They
Mhm.
should know what is his weight or BMI, what is the blood sugar, what is your creatine or GFR, whether your urine has protein leakage. Blood sugar, HbA1c, 6 months, 3 monthly blood sugar. Cholesterol, these are the figures you must know. So know your numbers or know your health numbers is very important. If you know your numbers, aim to get a perfect figure. A perfect figure is what? A BMI less than 25. In Indians, it should be less than 23.5. HbA1c closer to 5.5. LDL around 70, your cholesterol less than 200, and so on. So if you have a perfect figure, that gives you a healthy body. So एक चम्मच कम, 4 कदम ज्यादा, know your numbers, have a perfect figure. So you ask for lifestyle, this is the way lifestyle has to be.
Right, right. I think very nicely summarized, Dr. Umesh. I mean, this know your numbers is a very interesting concept, and I think anyone who is listening to this, I mean, it's quite understandable. And the pointers that you touched upon, be it your HbA1c or your cholesterol, I think these are very important considerations. And I think thank you for bringing that out. So that now brings us to the next edition of this podcast, the next section of this podcast, which is essentially about summarization. So we've already talked very extensively about blood pressure, kidney disease, how they are interrelated. We've also touched very nicely upon the lifestyle interventions. So for somebody who is now listening to this podcast, what would be your important takeaways that if you want to really summarize this session, how would you summarize that?
So remember a few things. One, as soon as you cross 18 years of age, start thinking that you must get your blood pressure checked. Two, cut down on salt, increase your exercise, get your processed food out of your house. Third, get your kidney health checkup done every year, especially if you are diabetic, if you have high blood pressure, if you are obese, if you are a senior citizen, if your family member has kidney disease. Remember, kidney disease is silent. So therefore, it should be checked not after the symptoms. Kidney disease is common. 1 in 10 people in India have CKD. It is harmful. India cannot afford the treatment of kidney failure. It is reversible and controllable and treatable. So, Bayer, thank you for bringing out this idea to do podcasts, helping people, making them aware of the importance of blood pressure, diabetes, and taking care of the kidney health. And that too, in and around World Kidney Day. This time slogan itself is, are your kidneys okay? You have also helped us in trying to get people checking their urine for protein leakage, the UACR estimation, which itself will pick up kidney disease much earlier. Bear is doing a great job, and we are happy to be a part of this podcast spreading awareness. Thank you,
Wow,
Parikshit, for
that's
having me.
that's an excellent summary, sir. And I think we are really thankful to you for taking your time out. I think you're doing some pioneering work in terms of kidney health, and we really applaud your efforts. And thank you very much, sir, for being a part of this podcast. And we hope to interact with you in many other such educational programs. So thank you again,
Sure.
sir. And
Thanks.
to our listeners, if you found this episode helpful, share it with your loved ones and stay proactive about kidney health. And we'll catch you next time. So until then, take care and stay healthy.
Thank
To get
you.
more health updates, please like, share, and subscribe Bear for Health India on Facebook, Instagram, and YouTube. Thank you so much to all the listeners. Thank you, Dr. Umesh. It was really a pleasure interacting with you. Thank you.
Thank you. Same here.